Hello class, I will start by introducing our group. I am Tanisha Patton. Here we have Marie Owens, Cabria Lindsay, and Aaron Gamage. We will be discussing alcohol used and abused. Let's first define a few key terms that will be used frequently throughout the presentation. Binge drinking is defined as having 5 or more drinks in one sitting, making blood alcohol level at or above legal limit of 0.08. Alcohol use disorder is defined by DSM-4 as someone using alcohol to self-medicate and it is causing harm to them mentally or physically. Although the gateway drug theory is not widely accepted, in this case it yielded great evidence that alcohol serves as a gateway towards the use of other harsher illicit drugs. In this study, it showed that young adults were more likely to try other drugs having tried alcohol first. While alcohol use is not illegal, many young and middle-aged adults report abusing alcohol in their life. In many cases, the abuse or binge drinking is very severe. A study done by National Institute on Alcohol Abuse and Alcoholism reported that in 2012, 17 million adults ages 18 and older reported suffering from alcohol use disorders. And of that same group, 24.6 reported engaging in binge drinking within the last month. A survey done in 2014 by the North American Opiate Medication Initiative revealed that maternal alcohol abuse was associated with sexual, emotional, and physical abuse, while paternal alcohol abuse was associated with childhood physical abuse, with increased severity would lead to a child's first encounter with alcohol beverage. While drinking is very prevalent among young adults, it is shown that many are self-medicating due to mental illness and a lack of access to substantial health care. A college student suffering from mental illness is more likely to misuse alcohol as a young adult age, and going into middle age, alcohol use sometimes become worse depending upon the stressors of everyday life. When faced with mental illness, marital stress, familial issues, work-related stress, many adults abuse alcohol. Now let's discuss cultural factors. In many cultures or settings, drinking is accepted. In European cultures, though drinking is not uncommon, stigma is attached to certain beverages. Beer and hard liquor such as vodka, rum, tequila, and cognac are consumed with the intention of getting drunk, while wine is cultural and consumed with meals. In Western society, where alcohol abuse is more prevalent, it is both socially and culturally stigmatized. Amongst young adults, they engage in drinking games resulting in binge drinking. Almost every social event is surrounded by or involving alcohol. Alcohol in the war times is also a part of our culture. Many veterans and those on active duty also use alcohol as a coping mechanism to yield the things that they are dealing with from the traumatic wartime events in their past. While binge drinking is more common among young adults ages 18 to 34, binge drinkers 65 and older report binge drinking average 5 to 6 times a month, while their younger counterparts only reported 3 to 4 times a month. While alcohol use is widespread throughout our culture, it is excessive alcohol use that kills an average of 88,000 each year.
In adulthood, drinking frequently moves from a way of rebelling and a way of fitting in with peers to a way of socializing, relaxing, and managing stress. Work and marriage have more of an impact on drinking in adults compared to the drinking that happens in single, more socially active, emerging adults. In general, positive experiences that create a sense of well-being frequently lead to less risk-taking behavior such as alcohol or drugs. People are less likely to self-medicate. Studies have shown that work-related problems and having work influence a person's time with family have a higher odds of developing drinking problems down the line. On the other hand, when family time has a positive impact on work or productivity, there are lower odds. The same study has shown that in family dynamics involving alcoholism, it creates circumstances that are counterproductive to marriage and interacting with children. On the other hand, these studies haven't examined as much of the various causes of drinking outside of the work and family balance. The authors of the study have also suggested that a family that has specific boundaries and limits around drinking in the home may have some impact on alcoholism being passed down from parents to children throughout generations. In a recent study, they have found that as drinkers become parents, they have an impact on the drinking habits of their children. There was a parenting guides for adolescent alcohol use that was designed to help parents teach their children about alcohol. A qualitative study was done comparing parenting to the guidelines recommended to parents. In the study, they found that parents attempted to minimize harm and promote healthy practices.
Ethical considerations concerning alcoholism. Ethical considerations regard moral values or decision-making and can either be at the individual or societal level. An ethical consideration or factor surrounding alcoholism is the question of whether or not alcoholism or addiction as a whole should be considered a disease or not. It seems the verdict is still out on that. While many believe that it without a question is a disease and should be considered as such, some believe otherwise. According to Nick Heather, alcoholism has shifted from a disease perspective to a public health perspective in terms of alcohol-related problems in the last 20 or 30 years. This means that people's attention is no longer focused on the characteristics of the people doing the drinking, but is now focused on the characteristics of the addictive and potentially poisonous substance ethyl alcohol. This substance affects a large portion of the population, both people addicted to alcohol and those not addicted to alcohol. Other ethical considerations surrounding alcoholism include issues of drug treatment and where the money should come from to support these treatments, issues of rehabilitation centers and how many times a patient should be taken back after relapses, and the issue of alcoholism or addiction in general being considered a mitigating circumstance from some associated crime or misbehavior. This means that someone being addicted to alcohol may get a lesser punishment or consequence for a crime committed while they were intoxicated as a result of their addiction. This is considered an ethical consideration because for those who believe that alcoholism is a disease and not a choice, alcoholism as a mitigating circumstance would make sense. But for those who believe otherwise, this may be an ethical dilemma. For example, if someone was harmed in the process, what would the loved ones of the victim think about mitigating circumstances? Social structures or factors regarding alcoholism. An alcoholic's immediate environment can be affected by their substance use or abuse as well as society as a whole. Others can be affected in many ways, such as a traffic accident or violence shown by the person with alcoholism. Alcoholism has an impact on society as a whole in terms of resources required for criminal justice, health care, rehabilitation centers, and other social institutions. Alcoholism affects a person's work environment and how well they are able to perform at their place of employment. People with alcohol dependence are on sick leave more often and more frequently than other employees, which causes significant cost to employers, other employees, and Social Security systems. There can also be accidents at work as a result of alcoholism or alcohol use, as well as a reduced level of productivity at work. Unemployment is often a result of alcoholism as well. A person's family is greatly affected by their alcoholic actions. Drinking affects a person's ability to perform as an active member of a family or group, such as their ability to perform as a parent or partner. Mental health issues can occur in other family members as a direct result of alcohol use in their loved one, such as anxiety, fear, or depression.
Indeed, behind only smoking and obesity, excessive alcohol consumption is the third leading cause of premature death in the United States. Higher levels of alcohol consumption are associated with increased cardiovascular risk. Heavy alcohol abuse is one of the most common causes of reversible hypertension. Accounts for 1 third of all cases of non-ischemic dilated cardiomyopathy, is a frequent cause of atrial fibrillation and markedly increases risk of stroke, both ischemic and hemorrhagic. More frequently have adverse consequences of acute intoxication. For example, accidents, violence, and social strife. In fact, among males aged 15 to 59 years, alcohol abuse is the leading risk factor for premature death. The consumption of alcohol affects a person's stomach, mouth, circulatory system, kidneys, lungs, brain, and liver. Alcohol in the stomach can cause stomach lining irritation, which leads to ulcers. Alcohol will decrease your appetite as a result of increasing gastric juices flow, which can lead to malnutrition. On an empty stomach, alcohol will pass directly into your bloodstream. Heavy drinkers increase their chance with developing cancer in their mouth, esophagus, or throat. Once alcohol passes straight into your bloodstream, it causes your blood vessels to widen. This will result in low blood pressure, pulse rate, and higher body temperature. Our kidneys is our most important filtration organ. When alcohol enters the blood, the kidneys can filter it out as little as 20 minutes later. This can lead to thirst or dehydration if it becomes excessive. Because alcohol slows down the body, the lungs become more at risk for aspiration, which is when foreign objects enter the lungs because sphincters are not properly functioning. Alcohol affects the brain immediately for not being able to control behavior and functioning properly. The increase of a person's blood alcohol level also increases loss of control such as motor abilities, self-control, vision, balance, speech, and a potential loss of conciseness. The liver is the organ that tries to maintain homeostasis, which is about balance in the body. However, the liver can only oxidize 1 drink per hour. Regular alcohol consumption can compromise your liver, which leads to liver damage such as cirrhosis. However, moderate drinking is recommended. That is 1 drink per day for women, and 2 drinks per day for men. The health benefits is that it reduces stress, heart disease, strengthens bones, and increases your appetite. It is associated with decreased risk for total mortality, coronary artery disease, diabetes, congestive heart failure, and stroke. This gives you the opportunity to be more active in your community.
Alcoholism demographics. Alcoholism is a concern for all races, cultures, and ethnicity. Alcohol has no boundary nor does it discriminate. According to the research done by Bryant and Kim, alcoholism is more prevalent in non-Hispanic whites, followed by Latinos, American Indian, Alaska Natives, Blacks, and Asians. Excessive alcohol use led to approximately 88,000 deaths each year in the United States from 2006 to 2010, shortening the lives of those who died by an average of 30 years. Further, excessive drinking was responsible for 1 in 10 deaths among working-age adults aged 20 to 64 years old. America's binge drinkers are fueling an average of 6 alcohol-poisoning deaths per day, and the rates are highest among non-Hispanic white, middle-aged men, according to a new government report. Younger adults are more addicted to hard liquor such as tequila and vodka, while middle-aged adults prefer to binge on beer. Most of the estimated 1.5 billion binge drinking episodes each year involve Americans who are 26 and older. But CDC researchers were surprised to find that people aged 35 to 64 accounted for 3/4 of America's alcohol poisoning deaths each year from 2010 to 2012. Alcoholism is more dominant in those who also smoke. There is also a high correlation with those who live below the poverty line, suffer from unemployment, and have better self-rated health, as well as those who have psychological distress. Approximately 1/2 of the U.S. adolescents ages 18 to 24 years old are enrolled in college on a part-time or full-time basis. 60% of all college students drink alcohol compared with 52% of same-age peers not in college. Research also shows that 40% of college students engage in binge drinking. About 1 in 4 college students report academic consequences from drinking, including missing class, falling behind in class, doing poorly on exams or papers, and receiving lower grade averages.
Alcoholism social challenges. Looking at Bandura's social learning theory, which states that learning is a cognitive process that takes place in a social context and can occur purely through observation or direct instructions, even in the absence of motor reproduction or direct reinforcement. This leads us to the social aspect of those who come in contact with people who drink alcohol. Those who struggle with alcohol addictions are likely to have problems maintaining family and social relationships, as well as experiencing difficulties in academic or professional achievement. Adolescent peers have an influence on their alcohol consumption, and evidence supports peer influences in adults as well. Adults select peers with similar drinking habits but are also influenced by peer drinking at ages 21 and older. Network drinking was associated with incident alcohol dependence after adjustment for parental alcohol problems. Family members, including children exposed to first-degree relatives' alcohol problems, are at risk for problems. Children of parents with alcohol addiction show higher rates of alcoholism than children who do not have parents with an alcohol addiction. Family culture and family dynamics contribute to an individual's risk and vulnerability for alcohol use disorders, as well as providing protection and resiliences. The alcohol problem of a single family member may lead to a broad distortion of the family process, thereby increasing the risk for family dysfunction, domestic violence, or other problems. Society is affected in numerous negative ways by addiction and associated problems such as accidents, poverty, criminal behavior, homelessness, and higher rates of transmission of infectious disease. Society is burdened in many ways as a result. For example, the economic cost of addiction in the United States is estimated to be $223.5 billion for medical and social services, lost income, cost of treatment, and many other indirect costs of addiction. The use of alcohol is associated with an increased risk of injuries and accidents. Even a single episode of excessive drinking can lead to a negative outcome.
While we show the effectiveness of both the gateway drug theory and Bandura's social learning theory, we gain perspective as to why alcohol is a bigger problem than we previously thought. We see that any person faced with hardship, if they have tried alcohol, are more likely to try harsher drugs if not taught how to properly cope. Also, that in social setting, binge drinking is commonly accepted and displayed throughout society in both real life and in media outlets. It affects not only ourselves, but society as a whole. Alcoholism affects both home and work life, creating significant issues in relationships and causing both mental and health issues. Certain ethical considerations regarding alcohol are controversial. Is it a disease or is it a choice? As future social workers, it is our duty to recognize not all binge drinkers are alcohol dependent, screen clients who are binge drinkers, and educate them on the effects to their body and their life. Work with legislatures and communities to implement strategies to prevent binge drinking, build partnerships amongst schools and communities, and help understand the laws surrounding binge drinking, and advocate for our clients who are not receiving proper health care and are self-medicating. And with that, I'll say thanks for joining us today.